For decades, these pills worth pennies were seen as the wonder drug for patients with an irregular heartbeat known as atrial fibrillation. Fiona Birdseye was one of them, but not anymore. Now she relies on the blood-thinning medication warfarin. But aspirin was the drug she'd been given after having what's called a mini-stroke last year. A fortnight later, she was back in hospital after an actual stroke.
It's incredibly frustrating. I may well have had the stroke, even if I'd been on an anticoagulant. But the fact that I was prescribed aspirin, which was absolutely, I find out now, useless, gave me no protection whatsoever.
Now new NHS guidelines are expected to tell doctors to stop prescribing aspirin for atrial fibrillation, or AF.
Your heart's irregular, and looking at the recording, we call this atrial fibrillation. Just means that the heart's got a funny rhythm.
Consultant cardiologist Professor Martin Cowie says AF patients on aspirin must go and see their doctors.
About 12,000 people a year in England have a very disabling stroke due to the fact that clot forms in the heart and shoots off and damages the brain. Now, we in the past used to use aspirin to try and prevent such a stroke, but we now know that that is not an effective treatment.
Campaigners believe 7,000 strokes could be prevented every year if people with AF were given better medication. Aspirin, for example, reduces the risk of having a stroke by just 18%, whereas anticoagulants can cut the chance by 65%. Over 300,000 AF patients use only aspirin to reduce their risk of having a stroke. The alternative is the blood-thinning drug warfarin. But now there's a new generation of anticoagulant with far fewer side effects. But there's been concern about the cost.
At first glance, the new drugs seem far more expensive than warfarin or aspirin. However, if you take into account the regular blood checks you have to have with warfarin and the clinics that have to be run and the consequences of some of the bleeding caused by warfarin, then the new drugs are just as cost effective.
Fiona is taking no chances with her health now. She has a testing kit to make sure she's not at risk of another stroke. She knows just how dangerous it can be if she gets her drugs wrong. Emma Birchley, Sky News, Bracknell.